Blood pressure. You wake up one day in the morning and you notice that you have a dull, nagging headache. You do your morning stuff, go to the office, start working, the headache is still on. It is lunchtime. You go to have your lunch, come back to work, and the headache is still on. And then by late evening, you decide that I am not liking this headache, let me get my BP checked up. Now when you check your BP turns out to be 180 by 120, which is way high. And suddenly, in the next few minutes, this dull, nagging headache slowly converts itself into a pounding, severe headache. It becomes so severe that you feel like your head is going to burst. You notice that you're getting palpitations, you're able to hear your heartbeat, you start to sweat, you start to become a little breathless, you start getting a little bit of pain, discomfort in the chest, you have a pain in the back of your head or the neck. You begin to feel a little anxious, you are in a lot of discomfort, and then you decide to go to the doctor. The doctor checks you and tells you that your BP is very high. He asks you, what are your symptoms? And then you tell him all that you are experiencing now. Let me ask you one thing. You had none of these symptoms before you knew that your blood pressure was very high. All you had was a dull, nagging headache. Now, are all these symptoms that you are experiencing now because of the blood pressure? Or is it an emotional reaction to the knowledge that your blood pressure is so high? Moreover, everybody knows that blood pressure is hereditary and it is related to stress, anxiety and tension. Of course, there is also the secondary hypertension due to kidney disease, etc. I am not talking about them. They have to be dealt differently. And now when you go to the doctor and tell him of your high blood pressure, he will give you the medicines to control the blood pressure. What you need to realize is that blood pressure is only an effect. But the cause of the blood pressure is your stress, anxiety and tension. Does any doctor treat your BP by giving you medications to take care of the cause, which is the stress, anxiety and tension? No. Only the effect, that is the BP, is controlled with the medication. That is the reason you do not find a cure for blood pressure. You can only control the blood pressure but cannot cure it because only the effect is treated and not the cause. This is where homeopathy comes into play. Homeopathy is probably the only system of medicines which treats the mind, emotions, anxiety and stress. So when you treat your blood pressure with a combination of homeopathy and allopathy, homeopathy takes care of the cause and allopathy takes care of the effect. This will help you not only to control the blood pressure, but there are chances that you may be even cured of your blood pressure. Once you start on this combined treatment, and as your BP begins to come in control, you may slowly start to taper the allopathic medication. In the past 33 years plus, we have had more than 32,000 patient visits to the clinic for blood pressure, and we've been able to help most of them. About 200 years back, they measured the BP of hundreds of people and came to a conclusion that the average blood pressure should be around 120 by 80. Remember, this was done 200 years back. Back then, our ancestors were 95% active physically. They used to be in the field, they used to be cycling, they used to be walking around. But in today's generation, we are 95% inactive and indoors. So, how can you expect to have the same average reading that they had it 200 years back? Is that even possible? In our country, over 70% of the people who live in the rural areas or those people who cannot afford medical care do not check their BP even once in their lifetime. And they lead a wonderful life than you and me, and they probably live as much as you and me too. The moment you are diagnosed with blood pressure, all hell breaks loose. You have many people coming and telling you what to do, what not to do, what to eat, what not to eat, how to live your life, how not to live your life. They even scare you as to what can go wrong and how dangerous blood pressure is. This puts the fear of having a heart attack or a stroke in you. Now all this puts a lot of stress on you and you suddenly begin to age. There are millions of people having blood pressure and they lead a normal and a happy life. I do agree that blood pressure does have complications. The percentage of people having these complications are very few. But human nature is such that we look only at those few people who are having complications and we get very scared and we live the rest of our lives in fear. That's not the way to live your life. Take care.